So I guess we can introduce ourselves first. I'm Christy Null. I'm the supervisor for the Early Start Unit serving birth to 3-year-olds with developmental delays in our Santa Rosa office serving Sonoma County.
And I'm Katie Pedgrift. I'm a clinical psychologist with North Bay Regional Center, and I primarily work in our intake department.
And hi, I'm Claudia Ricci. I'm a case management supervisor for children 3 to 22 years of age, sometimes a little older. And I also work in the Santa Rosa office.
And so I know that some folks may not be here and that you're recording this Larkin. And if you know of questions that parents have asked or that the community wants to know about, please feel free to ask at any time. I think that we're a small enough group. I'm totally comfortable with you unmuting yourself and asking questions. I saw that there's a parent of a new client here. And if you have any questions as we're talking, please ask, because we want this to be useful information to you all.
Absolutely. Thank you.
All right, Christy, there we go. So we're going to be talking about the programs and resources that are available through North Bay Regional Center. So we'll start by kind of talking about regional centers in general, and then talk about the two very different programs that are housed under Regional Center, which is our Early Start program and then our Lanterman services. So about regional centers in general, we're nonprofit community-based agencies that are in California. Only California has regional centers. And we provide services for children and adults with disabilities. And we're contracted through the Department of Developmental Services. So throughout the state of California, there are 21 regional centers, and we're all regionally located. I'll show you a map of where we are. All of us are governed by the Department of Developmental Services, and we're also each governed by our own board of directors. And I'll say this once now, and I think that you'll hear us say this again, that we are always the payer of last resort, meaning that if a child or an adult can access any kind of service through their medical provider or through any kind of generic resource in the community, then regional centers are not to pay for it. So we're to pay for services that are not being provided in the community. So this is sort of our regional map here in California, where our regional centers are located. Like I mentioned, there are 21. And so we're right up here. We're North Bay Regional Center. And so we serve all people who are living in Sonoma County, Napa County, and Solano County. So if you were to move out of our catchment area, your case would move into the regional center for which you live. And I'll let Christy talk about Early Start.
Okay. All right. So anyway, so Early Start is a program for birth to 3-year-olds who have developmental delays or who are at risk for developmental delay. And we're both federally and state funded. It is a federally mandated program under the Individuals with Disabilities Education Act, or IDEA. So there are a couple parts to IDEA. There's Part B, which is services for kids who are 3 up to 21. And then there is Part C, which is for those kids who are birth to 3 years old. And so basically, to be eligible for Early Start, children have to have like a 33% developmental delay in one of the different developmental areas. And we'll kind of go into those in a minute. They could also have an established risk condition, which is a condition which is considered to have a high probability of resulting in developmental delay or developmental disability. And this could be something like genetic syndromes, Fragile X or Down syndrome. And then also those babies who may have a combination of 2 or more risk factors for a developmental delay or disability. And these would be, say, a combination of maybe premature birth, where you have a baby that's born less than 32 weeks gestation, combined with maybe they needed assisted ventilation at birth, We have babies who've been prenatally drug exposed, also babies who have had a central nervous system insult, may have had some kind of damage that way. So if babies have 2 or more risk factors, they end up being referred to us, often by the hospital at the time of discharge, but sometimes it's by their primary medical provider. And so during the intake process, basically, actually, even before the intake process, anyone can refer to Early Start. Our primary source of referral is the doctors, but parents self-refer. There are daycare providers that refer, there are preschool providers that refer. And we start off by asking the parents just to sign, consent to evaluate and to exchange information within the Early Start program as we're starting that assessment process. Family assessment is really kind of asking families, what do you think your child's strengths and needs are? Kind of what did bring you to our program? But also, kind of what are you seeing as your child's strengths and day-to-day life? And also, what are family resources too? Are there extended family members who are available to say help out? Maybe, people have daycare providers already, your medical home, who's the primary physician, just kind of like who are the supports in place. We do have a nurse who does review records that come into us, whether they're medical records. Sometimes we don't have any medical records from the primary care provider, and we'll request those, using a release from parents. And she'll also review kind of just the intake reports to see, is there anything that we could be missing or and possibly need to follow up on. And then, big key here is the developmental evaluation to include the following areas of development. So we're looking at cognitive skills. We're talking birth to 3-year-olds. So, this is very young problem-solving skills of looking at what kids are able to do, sort of how they're relating to their environment, how they're playing with toys. We're looking at physical and motor skills, both fine motor, how children are using their hands. They're again grasping toys, babies, infants when grasping parents' fingers. Gross motor skills. This would certainly be your beginning head control onto sitting, crawling, walking, jumping, that type of thing. Communication skills, both looking at receptive language, what babies are taking in, and then as they get older, what they're understanding. And expressive language, going from there again, cooing to babbling, onto using both verbal and nonverbal communication. Social emotional development, and then also finally adaptive development, to looking at early feeding skills and moving on from there to early dressing skills, what little ones are pulling off, then what they're assisting to put on, and then finally toileting as they get older. And then in addition to that developmental evaluation, there's a specialty evaluation in the area of concern. So if we have a toddler who's referred due to speech concerns, we'll do a speech evaluation as well as a developmental evaluation. We might be doing a physical therapy evaluation as part of the intake process too, if there are motor concerns. So depending on the area of concerns, we might have a couple specialty evaluations along with the developmental. And all this is, we want to do all of this within 45 days of referral. And then if the child's eligible, we write up what's called an individual family service plan, or IFSP. And basically that's going to include information about the child's development based on those intake reports. It's going to have specific outcomes that are developed, certainly with the parents, and what they want to see the child doing and what kind of progress they want to see. And then we review that plan at least every 6 months, although we can make changes at any time through addendums to the plan as well. And then regional centers will coordinate ongoing service delivery and get the various service providers into place. And early start services will, may include, depending on the child's needs, audiology or hearing services. There is part of Early Start. There is a deaf and hard of hearing program as well. family training or counseling, nursing, nutrition, occupational therapy, physical therapy, special instruction. This is a big one. Most of our little kiddos will receive some type of infant program, and it might look like, you know, once a week home visit from an infant and parent educator who's giving the family, not only directly working with the child, but giving the family ideas on what they can do kind of 24/7. And then there are also infant program groups as well. There's speech therapy. There are also vision services for those little ones who have any difficulties, any vision impairments. And what we try to do is we try to provide services in a child's natural environment. So for kids who are birth to 3, we're talking about the home environment, daycare, preschool, or it could be an integrated community setting where children are around typically developing peers. So that's a possibility as well. Obviously, during the pandemic, things look quite different. We've had, you know, services via Zoom, services via phone calls, dropping off materials, kind of any which way we could make this work. Slowly but surely, services are returning to in person again, and it's kind of at this point it's at the comfort level of both the person providing the services and the family, and we certainly have a full range of where people are and comfort level at this point, kind of in this whole experience. But it is nice to see things opening up more and children starting to get more actual in-person services. And, you know, those might be out in a yard where it's a little bit safer right now and everyone's masked. And obviously there are challenges there too when you're talking about, say, speech therapy and wearing masks. So yeah, it's been challenging. It's been quite a challenging year. NBRC, as Katie mentioned, we are considered the payer of last resort. So if there are generic resources such as private insurance that will cover speech therapy, we'll have, you know, families access their insurance first. We have been able to pay copays though, sometimes, like let's say if Kaiser is covering speech therapy or physical therapy. We've also found that for, you know, unless a child actually has a diagnosis, typically insurance will not cover a lot of the early intervention services. So, you know, I'd have to say it's kind of the smaller portion of kids through Early Start who actually receive services through private insurance versus being funded by regional center, just based on the fact that many of the kids that come to us don't have a diagnosis. There's also California Children's Services, their medical therapy unit that for a certain number of kids, they do provide occupational therapy and physical therapy. So sometimes, you know, they might be in the picture, they might be providing those services, but then regional center is providing other things like infant program and maybe, you know, feeding therapy if that's needed, or just helping even, you know, we've got a couple kids where we're just providing that service coordination. And there might be some other players that are providing the actual coverage of the early start services. And then I mentioned the copay already, that sometimes we can cover that as well. The transition process, this is a big part of early start. So since we end at age 3, we start pretty early on, around 2.5 years of age, but it can be anywhere between 27 months of age up until 33 months of age, where we start the transition planning process, where we want to look at, okay, what's going to happen next? Because early start is ending, we need to look at, does the child continue to need services at age 3? And we'll hold a transition individual family service plan, and ideally with a representative from the school district too, because they're going to take over the educational piece. And there again, goes back to the Individuals with Disabilities Education Act of, you know, the early intervention services being up to 3, and then the schools taking over at age 3 on up to provide educational services. And the idea is that we want that referral going to the school district too by 33 months of age, because then that starts their timelines, and they have to hold an individual education plan meeting for the child by the 3rd birthday. So we want kind of a smooth transition. We want, you know, early start services are ending. that IEP is being held, and then we go from one system right into the next at that point. And the early start team will also then look at too, like eligibility for ongoing Lanterman services that Katie will kind of go into more, and what that might look like in terms of eligibility after the age of 3. So some children will continue on with the school. Some children will continue on with both school and Lanterman services at the age of 3 and have not only a plan with the school, but a plan, an individual program or IEP with North Bay Regional Center as well. So in terms of, you know, the referral process, I know you guys are already connected to Common Ground Society. So but here is the referral information. And Larkin, do you want me to just kind of send you this too, so that people just have it again for sharing with others? And,
yeah, that would be great. Thank you.
because there are multiple ways to refer. There's the warm line phone number, there's sending an email, there's fax, there's going on to the North Bay Regional Center website as well and clicking on early start. And then as you know, as we're getting everything started, the services evaluations intakes are done in the child's and the family's native language as well. We certainly have a lot of, with Spanish being so widely spoken, we have a lot of bilingual early intervention service coordinators, and we do have a lot of bilingual service providers too. There are times that we do need to use interpreters, and we'll do that as well. And particularly when you start getting into some of the other languages that we may not run into so frequently within Sonoma County. And Navigator phone line. This is just kind of in addition to early start. People can sometimes have just general information about where do I go? Birth to 5, I have this, I don't know who I need to refer to. I don't know who to go to at this point. So Early Learning Institute houses what's called the Navigator phone line, which is First 5 funding. And basically they're there every day, Monday through Friday, to answer just kind of basic questions of where to go next, and hooking parents and providers, medical providers or daycare providers who might be hooking them into, okay, well, oh, no, you want to refer to Early Start, or maybe you want to refer to Watch Me Grow, which is more of a kind of a screening and monitoring program. And then for like the over 3s, the school services, the Lanterman services, and just other community services that are out there. So before Katie goes into Lanterman, is there anything in particular related to Early Start that?
Yeah, somebody asked on our Facebook group, how long after the psychological evaluation and the diagnosis by their specialist should it take? It's been 3 or 4 weeks since they completed that.
So it takes, and this is specific to Early Start, right? Because typically we don't do a diagnosis, but if you're talking about the developmental, that's not part of intake. Diagnosis, I'm assuming it's the developmental evaluation.
Yeah, she said, I've been in the application process since October 2020, waiting for entry, but no word yet.
Okay.
That's probably a Lanterman question, I would guess.
Okay.
I would say how old, yeah.
Yeah, she didn't state, but I'll look at her Facebook page, see if I can figure it out.
So I was going to say, if it's Early Start, it should not be taking that long. So then I should know. Yeah, because Early Start, like I say, it's 45 days for the intake process to the individual family service plan. And then it's another 45 days. I don't think I mentioned this earlier. Another 45 days after that, after the IFSP is written. Typically it's faster, but 45 days in which services begin.
Okay, that's what I thought you had said. So it looks like it's potentially an older child. Yeah.
So it's probably a question about Lanterman, and I'll talk about that. We have a lengthier intake process.
Okay.
So are we ready to switch gears?
Does anybody else? Oh, there's another one. My daughter had the regional center, then started with the school system at 3. Can we reach out and find out if she still uses services? She's now 8.
Well, this portion will be really helpful to answer this question, to see if her child has one of the qualifying conditions.
Okay, great.
Kind of as a general rule, folks who are exiting out of EI, you know, some of those kids had a developmental delay and now they've caught up and now they don't need any more interventions. They're going to be, you know, mixing in regular education with their peers. And then there are other kids who continue to have some delays that need to be addressed through special education, and they can access those special education services until they're 22. And then there are another subset of kids who have a disability that is known to be a lifelong disability. And those are kids who may be appropriate for Lanterman services. So we call these Lanterman Act services because these services were established through a law called the Lanterman Act, which was started in 1969. And the law kind of recognized that people with developmental disabilities weren't able to access supports and services in the community like people without disabilities. And so I sort of think of this as a civil rights issue. And that's kind of what regional centers do when they're advocating for these Lanterman Act services, that we're advocating that people can access all the same supports and services to live as independently as possible for the duration of their life. So I'm going to talk a little bit about the eligibility criteria, the services that are available through North Regional Center, and the application process. And I just saw a question pop up. Do these services end at 22? And no, these services are lifelong. So once someone becomes eligible for Lanterman services, they are eligible for those services throughout the duration of their life. So there are 4 disabilities that the state of California recognizes as developmental disabilities, and those are cerebral palsy, epilepsy, autism, and intellectual disability. There's also a very confusing 5th category, which are disabling conditions that are found to be closely related to intellectual disability or to require similar treatment. Intellectual disability was formerly called mental retardation. And I think a lot of practitioners were hesitant to label children with mental retardation because of the stigma that came along with that. And so we kind of have this category for people who may not have a formal diagnosis of intellectual disability, but their functioning is similar and they really need the same supports and services. And so that's what this category is about. So there are kind of 3 criteria that someone needs to meet in order to be eligible. One is to have one of the developmental disabilities that I just mentioned. And that condition has to originate before the age of 18. So it's developmental in nature. And these are disabilities that are expected to continue indefinitely. So these are conditions that are expected for a person to have throughout their childhood and their adulthood. And then the final criteria is that it has to constitute a substantial disability for the individual. And I'll be really specific about what that is. That term is it's a legal definition. It's defined in the law, and it fluctuates according to the funding that California has available to it. And so right now I'll clearly define for you what that is. And there are specific things that the law has decided are not developmental disabilities. So traumatic brain injury is not considered a developmental disability. Psychiatric conditions like schizophrenia or a bipolar disorder are not considered developmental disabilities. And learning disabilities are not considered developmental disabilities. So as of today, in order to qualify for Lanterman services, a person has to have significant functional limitation in 3 or more areas of major life activity. And like I mentioned, this definition of substantial disability fluctuates with funding. When regional centers were initially put together, a person only needed to have one area of substantial disability. Later, they needed two. Today, a person needs to have three areas. And so it can be tough for a person, even a person who's been diagnosed with something like autism, to show that their autism leads to significant functional limitation in three or more areas. So I'll list the areas here. One is receptive and expressive language. So sort of how a person talks and how a person understands language. Another area is learning, how they function at school and how they're doing, kind of absorbing that information. Another area is self-care. Another area is mobility. This area of mobility doesn't refer to a person's ability to drive or use the bus. It's really specific in their ability to ambulate their body. So a lot of people with cerebral palsy may meet the criteria in this area if they need to use a wheelchair to mobilize. Another area is self-direction, and that sort of refers to the ability of a person to direct their own behavior. So often we see children with autism who might have excessive tantrums. So they might have really big reactions to what we might consider small problems. And we also might find that kids with autism need help focusing their attention on maybe the whole picture. So we might find that they might, if we just left them alone, they would direct their attention into one small area. And so they really need an intervention to expand that attention. And so those are kids that would, we would be, I think that every person that I've ever met with autism probably meets that criteria to have some functional limitation in their self-direction. So now these last two areas, capacity for independent living and economic self-sufficiency, those are really, I would say, impossible to evaluate in our children who are applicants. I think it's almost impossible to determine if a 3-year-old is going to be able to be economically self-sufficient in their adulthood, or if they're going to have the capacity to live independently. So unfortunately, for those last two areas, sometimes we can't really evaluate those until a child becomes an adolescent. Then we might be able to make some good guesses about those things. And so it can be quite common for a child to apply for Lanterman services when they're 3 or 4 or 5 or 6 and found to not meet criteria. And then that same person can apply again when they're 15 and we find that they do meet criteria. We find that, okay, you know what, she does meet this criteria. She's going to have a hard time with capacity for independent living. So she does qualify now. That's a very common thing. So we'll give a quick overview here of the services that North Bay offers. We have services that we provide directly. We have the majority of our services are provided through contracted service providers. And really the provision of people's services really depend on their individual needs. And I think Claudia will talk a little bit about what some of these services are.
Thank you. And I do want to apologize in advance if my dog starts barking. My husband will be home pretty soon and he gets really excited. So I hope he doesn't do it, but I just want to apologize in advance. And I'm alone, so nobody can stop him from doing it. So, okay. Thank you for the introduction, Katie. So Regional Center offers different services. We offer diagnosis and evaluation, individual program planning. This is very important. We call it the IPP. Through the IPP process, once we have children come either through the early intervention unit or through intake process, the service coordinator will make an appointment to meet with the family and go over the goals and establish those goals and identify the needs of the client and also identify the services that will meet the need. This is a very important process and it is driven by the parents, the families. And this is very important for families to understand because it is empowering, but also it it helps the parent to have ownership of what happens through the meeting process and what services they're going to get. The process is not driven by us or by the vendor that provides services. So in this process, it's important for families to reach out to the service coordinator and ask questions about, my child has this need. Is this something that the regional center can help us with? Oftentimes we find that either through community agencies, doctors, or teachers, they are told, oh yeah, the regional center will fund for this service. And then they come with us and they find out that that's not the case. And that breaks my heart that they are misinformed. So always please reach out to the service coordinator and ask if there's something that we can do. As we don't have a menu of services, though I'm going to present some of those services, but this list is not inclusive of all the services that we do provide under the Lanterman Act services. So I just want to make sure that you guys understand that a lot of people call and say, can you just give me a list of all the services so that I can pick and choose? And it does not work like that, because it is case by case, and it is based on the diagnosis given by the regional center, and it has to be attached to the IPP, to the individual program plan. So we have to always tie all the services we provide to the IPP planning. So we also offer prevention services, family support services, advocacy, program evaluation and monitoring, community education, community resource development, and the coordinations of services with community providers, health providers, Social Security Administration, recreation agencies, and direct service providers. So before we move into the next slide, does anyone have any questions on this?
Yes, can you speak a little to advocacy? In what circumstances and to whom would you provide that support? Or just as an example?
Well, an example is the service coordinators, they attend the IEPs scheduled by the school. So for that, it is very important that the parent asks the school to send an invitation to the service coordinator. Unless the parent requests us to be present during the IEP, the service coordinator will not be attending the meeting. That's one example. Other example will be we will refer a family client to Matrix. Matrix, they support families for the IEP process if they have questions regarding their services or their rights for the school, because they have more knowledge on the school system services. Another example will be we work in collaboration with clients' rights. And if we ever feel that with the information that the family share with us, that maybe their rights are being violated, we will refer our clients to client rights, and they will work with you guys.
Okay, great.
Okay.
Thank you so much. Because I think as my daughter's 5 years old, and I think my biggest, I'm gonna say struggle, is I don't know what to ask for from regional center. Like I don't, so this is fantastic for me. And I'm in East Bay Regional, so I'm not in North Bay, but this is great, because sometimes you just, my counselor person I just don't know, right? So I ask her, what else should I ask for? What else can you help me with, right? So I feel like I'm going in blind. So this is a great welcome presentation.
Yeah, and that is a great point, and I'm glad you brought it up. So just to help you, I guess, is when you don't know what that service looks like, or what is even the name of it, just start by describing the need of your child to the service coordinator. So you will say, this is what he or she needs, or this is what the family will need in order for my child to be safe or healthy, or to develop independent skills. So once you kind of articulate and describe what is the need, the service coordinator should be able to, at that point, to say, okay, sounds like maybe let's explore these services either through the community as a generic resource or through regional center services. Does that help?
Yeah, definitely. Thank you so much. I appreciate
You're
it.
welcome. You're welcome. If there's no more questions, we can move to the next slide. I can't, I don't know.
Are you unable to see the next slide, Claudia?
No, it's still on the same one.
No, I can see it. It did.
You see it? Oh, that's odd.
It still is stuck on. Oh, I take that back. Okay, that was where I look and it wasn't there. And then I look and it's there. Okay.
To be fair, they look very similar. So, you know, and it's like time for all, you know, it's late on a
It's
Thursday.
late. Thank you. Thank you. I'm gonna blame it on being blind, but okay. Okay, so services provided by vendors. So this is, like I said, a list of just some of the services that we provide. This does not include all of them. So we provide adaptive skill training, parent training and behavior interventions, nursing services, residential services, daycare supplemental services, independent living services, supported living services, supported employment, transportation access plans, and adult work and day programs. So as you can see, this list includes both children's services and adult services. So depending on the age, depending on the diagnosis, depending on the type of medical insurance, some of these services will be available to you through the regional center. And like Katie and Christy explained, again, we are the payer of last resort. So how the process looks like for clients or families to receive services is for the family, the parent, to reach out to us. And like I said, explain what is the need. Like just say, this is what's going on in my house. I'm in desperate need for, and just articulate what that is. The service coordinator should be able to then ask the right questions to identify who can provide the need. For instance, an example for nursing services, if you know, if we realize, because you guys shared that there is a need of nursing, we will ask what type of insurance do you have? And if they have partnership, we will ask if they have tried to access a service through partnership. And if they say no, then we will refer them to partnership to access those services. And for any services that the insurance does not cover, or that the school district does not cover, then we will review that request. And depending on eligibility criteria, most likely we will fund for those services. In the children's unit, as a supervisor, the most common purchase or service requests are for daycare and respite, diapers, and durable medical equipment, and behavioral services. So those are like the main services that come through my desk. And we approve a lot of this because daycare and respite is usually not a service covered through either the insurance or through the school system. And like I said, nursing, sometimes we do fund for that service if partnership is unable to locate a nurse or provide those services. So for Lanterman Act services, what we usually request from parents in order for us to provide a service we have to exhaust and explore every generic resource that there is. And if we can't provide documentation that that has been done, then the regional center comes in and provides the service according to the IPP and the diagnosis. Anybody has a question on any of the specific services listed or the ones that I just mentioned?
What does daycare supplemental services look like? Because I know that that is a big issue that sometimes daycare facilities won't take our kids and don't know how to, there's nowhere for them to go. So a lot of our families have been just doing it on their own this whole time. So I'd love to hear a little bit more about that.
Yeah, so daycare supplement services, we just supplement the cost of the service. We are not, we do not find a provider for daycare. So in that sense, we are of no use if that is the challenge that you guys are having, right? Because daycare is actually done through parent vendorization, where the parent becomes the vendor, and then we issue a check, and then they pay the provider that they choose. So we are not responsible in that sense to find a provider, but we do help to supplement the cost of the daycare.
Got it.
Claudia, is it like
thank you.
essentially like funding a babysitter? So we like that we pay for them to find their own babysitter? Yes.
And it is, yeah, a babysitter. It could be the daycare can happen through the school. Some schools offer after school daycare programs, and we only do it when they are asked to pay more than they charge a parent with a typical developed child, if that makes sense. So let's say that the school charges everyone $5 per hour, and they also are going to charge you the same thing, then we will not help fund for that service, because every parent has to pay for daycare services, right? The only part that we pay is the difference that parents have to pay due to the disability of the child. Does that make sense?
Yeah.
Yeah.
Thank you.
You're welcome. Any other questions on the services?
If families who have questions after I post the recording, would it be possible to, set a date? Like, you can watch the recording, ask questions right here, and then I can email them all to you and get the questions returned, rather than saying, "Oh, everybody just call," right? Would that be okay?
Absolutely.
Okay.
Yeah, I'm okay with that. And I just want to address Sarah. You mentioned your kid just got an email that he is now accepted under Lanterman Act services. I just suggest you to contact your service coordinator and ask questions. If you have a specific concerns or needs, just talk to the service coordinator, and they should be able to walk you through the process. And again, just keep this in mind, that any service that you're going to ask, always ask yourself, is this a medical condition? Is this something that perhaps my insurance can fund? And if so, try to pursue that. Is this a service that the school system can provide? Oftentimes families, it's a big change coming from EI into Lanterman Act, in the sense that through EI, you guys were offered a lot of services, and that's because the kid was still not a part of the school district. And once they come into Lanterman Act, they find that we refer them back often to their school for services. We refer them back to the insurance for services, and it's just that we do not get funding for speech services, physical therapy services, OT, because all these services are either provided through the school or through the medical insurance. But don't be discouraged, because we do offer a lot of services through children. And as they get older and they transition out of school at 22, we offer then adult services that include employment, day programs, housing. So just keep asking questions. And if you don't get the answer, always ask to speak with a supervisor. I will suggest you to do that.
Okay.
Perfect. I really appreciate that.
You're welcome. And the application process, are you taking that, Katie?
Oh, yes, I can take this one.
Thank you.
And so I can tell you that the application process can be a frustrating process because it's so lengthy. You can see here that someone can be in the application process for up to 5 months. And some of that is because, like we mentioned, these are lifelong services. And so we are really thorough and careful in how we determine if someone has a qualifying condition for Lanterman. And so you can start, the referral will give you all the information so that you can start that process. And then we have 15 working days to establish whether the referral is appropriate. So if a parent has a concern about possible autism or possible intellectual disability, that's probably an appropriate referral. Sometimes families may call with concerns about a learning disability or maybe even schizophrenia. And so we would want to refer them somewhere else to where they can get served appropriately. So once we've taken the application, we have 120 days to determine eligibility. And there's quite a bit of what can go on in that 120 days while we're collecting information. And I think that, yeah, there we go. So initially a family meets with an assessment counselor. And that assessment counselor will decide if more testing is needed. So perhaps a parent is concerned that their child may have an intellectual disability, but they've never been evaluated before. So then we'll go ahead and we'll do that evaluation for autism, for intellectual disability, for whatever it is that the parent has a worry about. There are other applicants who come to us who may say, I just got diagnosed with autism at Kaiser. And so then they would just share those records with us and we may not need to do any more evaluation. So we are really thorough in our review of records. We look through school records, medical records, behavioral records. We really look through everything when we determine whether or not a person has a developmental disability. And the deciding team includes a physician, a psychologist, the assessment counselor who met with the family, and an administrator. And we all get together, every week, and we look at all the cases that we have and vote on whether or not a person meets the legal criteria for a developmental disability. Once a person's eligible, we'll usually refer them to someone in Claudia's unit or one of our other children's supervisors, and their workers have about 60 days to meet and with the family and start developing the plan, because all of their services are going to be based on that plan. They're going to be based on that document that they come up with. If a person is found to not be eligible, like I mentioned, you can always reapply when you get new information. So if a young person applies and they were found to not meet criteria, they can apply again when they're 13 and now they're really struggling in school. And now we can maybe find some other areas of substantial disability. So people can always reapply. And if they disagree with the decision that we make, they can appeal that decision.
Can I ask a question, Dr. Katie? When is it appropriate to apply for it? Like under what, if I'm covered under regional center currently, my daughter's 5, she's in school. What precipitates me to apply for the Lanterman
If you have a child who you suspect or know has a qualifying condition,
Mhm.
I would recommend doing it right away to get in the system.
Okay.
Often people apply when they're in a state of crisis, when something is really, really going on, and then our lengthy intake process can be quite frustrating.
Got it.
So I really would apply now. And you will always have these services as a safety net for your child throughout her childhood and throughout her adulthood.
Great. Thank you so much.
I also have a question. So I was just reading over the email. Yeah, it says my son was made eligible for the services. So would that then now cue like that 60-day? Oops. I don't know what I just did on my phone. Will they contact me, or do I need to be the person contacting?
So are you someone who's in the application process for Lanterman services?
Well, I didn't recall doing any application, but my regional center coordinator sent me an email saying I wanted to let you know that he was made eligible for Lanterman services. But I haven't initiated anything. I guess.
So they should reach out to you
Okay.
within those 60 days and develop a plan with you about what kind of supports and services.
Yeah, just chocolate, nothing with.
Okay, perfect.
Sarah, it's because
Yes.
you're part of Early Start, right? With this,
Yes.
yeah. So what happened is in this case, it's part of that transition process, like when you did the IFSP.
No, I need to make sure because this one has all the.
You talk about the kind of the Lanterman services too, and what those next steps would be. And then it's not the same of where there's like a formal application process because you're already in Early Start and that early intervention service. Like assessment counselor does. Individuals who are older are so your early coordinator would act as the assessment counselor, kind of walk everything through that eligibility process and then let you know the results of, yes, eligible, in this case, eligible versus not eligible. And then at the age of 3, it actually, everything moves over then to one of the children's service coordinators so that they can reach out to you and develop the individual program plan.
Got it. Thank you.
And I see a question here. Is the intake inquiry packet supposed to be answered very generically and then more specific issues brought up is in the next step? Yes, I do think that's reasonable. If you're doing that online, to just very generically mention what concerns that you have about your child, and then you should get a phone call and follow up and really get in to the intake process. Any other questions or concerns? Oh, thank you.
Just hitting the buttons here. We missed the intake coordinator slide. Before the question slide, I just realized I'm hitting that.
And we'll be sure to get this to Larkin so that everyone has the email addresses and the phone numbers that they might need.
Excellent. Well, thank you so much. This was so helpful and such great information. I get a lot of questions about Regional Center, and now I know how to answer them. And I know that our group will really appreciate this recording and being able to look back on it. So thank you very much for your time. Really, really appreciate it.
Thanks for having us.
Thanks for having us. Exactly.
Right.
Have a good evening.
Great.
All
Thank you
right.
so
Have
much,
a good evening.
everyone.
Thank you
Bye-bye.
very much.
Thanks.
Bye.